Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is the basics of disc bulges and disc herniations. When you look at a normal intervertebral disc, it's actually 80% water and 20% proteins and collagens. There are two areas of the disc. The outer layer is the annulus fibrosus, that is stiffer and it does have some nerve endings. The inner gelatinous layer is the nucleus pulposus. It has no nerve endings whatsoever. Can't feel anything there. The disc is an excellent shock absorber. Water gets pushed out when we walk, bend, jump, twist, and then it gets sucked back in when the stress goes away. Disc degeneration occurs between the ages of 20s to 50s due to a number of factors. It could be obesity, smokers, repetitive trauma like a truck driver, genetics, and then social and environmental factors that we don't understand extremely well. This can lead to loss of fluid in the disc. It starts at 80% and then it goes down, down, down with degeneration. Starts to lose height in the disc, and then you can get tiny tears or cracks in that outer layer, which is the annulus, and that does have nerve endings, so it can feel pain. So the disc bulge, the best analogy is the loss of water. It's like a tire losing air, and it can start to bulge as a result, okay? So here you see a healthy disc. It has some white appearance on the MRI. That's water. Here's a black disc, and it's starting to lose the water, lose the height, and it starts to bulge. All right. There's been some studies that show 35% of those between the ages of 20 and 40 have degenerative disc disease on MRI with an appearance like this or worse, and no back pain at all. So it's important to understand that a lot of people with disc bulges, they don't have pain. If a tear occurs in the annulus, it can cause considerable back pain because there are nerve endings, okay? If the tear is large enough, then disc material from the inside, called the nucleus pulposus, can squeeze out. And this is called a slip disc, herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc. All these things mean the same, okay? So symptoms of disc bulge or disc herniation. Most disc bulges, as mentioned, don't cause any pain, okay? If they do, they can cause back pain. They can irritate the adjacent nerve roots and cause sciatica. They can also lead to some spasms and some aching. Now, if it does pinch on a nerve root from a disc herniation, it can cause a burning, searing pain down the leg, a pins and needle sensation, maybe some numbness, and then it can also lead to motor weakness, difficulty extending your leg or lifting up your foot, and then rarely incontinence. If a person does have incontinence, that's a surgical emergency. Well, how do you treat a disc bulge and herniation? First and foremost, you could do benign neglect. If you don't have enough pain to warrant, active treatment, then just watch it, okay? Over-the-counter medications may help, anti-inflammatories and Tylenol. Physical therapy may be beneficial along with chiropractic treatment. Then you have spinal decompression therapy, which is computerized intermittent traction. Acupuncture can help. TENS units may be beneficial. When it comes to prescription medications, there's a Medrol dose pack, which is a burst of prednisone for about 5 days. It just gives a lot and then it tapers off. That can help a lot with decreasing inflammation. Narcotic pain medications, non-narcotic pain medications like tramadol, muscle relaxers for short-term relief, neuropathic medications. Those are when we're talking about Lyrica or Neurontin. And now we have topical prescription pain medications, which can be great. Interventional treatments may consist of trigger point injections, which are subcutaneous injections that are great for spasms, intradiscal injections, which can help with the pain from degenerative disc disease. And this could be anything from steroid medication to platelet-rich plasma therapy to stem cells are now getting more popular for intradiscal treatment. Epidural injections, you do see one here. This is when numbing medicine is placed in steroid around the pinched nerve, okay? It doesn't fix the problem, but it can relieve the pain dramatically so that hopefully this piece of disc will disintegrate over time and the person won't need surgery. Well, what are the outcomes? Over 3/4 of those with degenerative discs and symptoms are able to avoid the need for surgery. Out of those with sciatica symptoms, over 95% are able to avoid the need for surgery. There was a study in JAMA, Journal of American Medical Association, back in 2006 that showed the outcomes of disc herniations at 1 year are no different whether a person has surgery or not in the vast majority of cases. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are multiple clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified doctors. Visit us today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.